Advances in technology may have changed the way we communicate today, but they have not replaced the value of face-to-face communication. Social media sites have increased our ability to interact and communicate, but they lack the valuable elements of communication, like body language, facial expressions, and tone of voice. These elements of communication are what give meaning to the words we use and bring our communication to life. Patient-provider interactions are just one example of communication. A provider's mastery of these elements can lead to successful patient-provider interactions and better patient outcomes.
In 2010, a study was released that showed the big gap between patient communication and provider communication. They took a set of patients and their providers and they asked them, how well did the providers address your fears and anxieties? Most of the physicians, almost 98%, felt that the providers addressed all the fears and anxieties. However, the same exact patients that they worked with, less than half felt that they had all their fears and anxieties addressed. What we try to do is to bridge that gap with this CURO Conversations.
Every provider knows the importance of communication, but recognizes it is not always easy. The CURO Conversations framework guides the provider through the patient conversation in a way that reduces suffering and builds trust. CURO is a Latin term that means to care for. The CURO model includes steps and behaviors that convey that feeling to the patient using these 4 elements. C, which stands for connect. U, which stands for understand. R, which stands for reveal and relate. And O, which stands for outcomes. Each element of CURO, whether used separately or together, can enhance patient-provider communication. Let's take a look at the 4 elements.
So it turns out that a lot of the emotional experience for patients with healthcare really has to do with what goes on right before we jump in and get started on the healthcare visit. And so, and sometimes patients are so wound up with worry or fatigue or frustration that we really need to try and overcome that and connect with the patient, because that's so important to their experience of healthcare. And really that can be pretty simple. It really is as simple as just remembering to walk in the room and look people in the eye and shake hands maybe and say, "Hey, I'm Dr. Murray. What you got going on today?"
After making a connection, the next step is to understand. This step of the model helps providers learn the reason for the patient's visit and partner with the patient to develop the plan of care. To understand the patient, a provider asks for the patient's story without interruption, demonstrates reflective listening, and shows true empathy. This can be a challenge, but when done well, it can deliver wins for both provider and patient.
As an emergency medicine physician, I often find that patients come in with different expectations. I have found it important to understand these expectations at the offset of the visit. I try to get to these expectations or understand the patient needs by sitting down in front of them and allowing them to speak with me directly for 2 or 3 minutes. This conversation gives me a reasonable idea of what patients' expectations are from this visit, and then it allows me to manage those expectations moving forward.
Connect and understand together create a platform for the 3rd element of the model, reveal and relate. The goal of reveal and relate is to provide information and instructions that a patient can follow after the visit is over. The behaviors that make this type of information easy to understand and follow include using plain language or other health literacy strategies like Ask Me 3 or Teach Back.
Frequently in the emergency department, as it is in the primary care setting, we'll see patients that need further testing and further evaluation. I think it's important as part of the process of talking with these patients that we need to make sure that they're able to relate their understanding of the process. Frequently when I'll see a patient, for example, with palpitations, I'll validate their concerns, letting them know that I am concerned about them and I'm glad that they came in to get checked. But I also want to make sure that they understand that there's going to be dietary restrictions and further testing that needs to happen. It's not going to happen today, but it does need to happen. And so whether I speak with the consultant and arrange that follow-up, or whether the patient arranges that follow-up, I want to make sure that they're able to tell me that they understand what that follow-up is and what needs to happen. I may ask the patient to say, you know, I've told you some things that are very important that are going to help maintain your health. Can you say back to me the important things so that when I leave, when you leave, we know that you understand the reasons for the testing that needs to happen and the lifestyle modifications. And I'll ask them to tell me back, don't eat this, take these medications, call this doctor, so that I know that they understand exactly what I said.
So the win for the patient is that they've had the chance to tell their story, they feel understood, and now they can understand the diagnosis and participate in the treatment plan in a way that can really only enhance outcomes.
And a win for providers are we just have a better workday. We relate better to our patients. We can enjoy our practice better because we have a lot of demands on us and there's a lot of control that we've lost. We feel like CURO Conversations and with the connection we make with our patients can help us regain that control. And we feel we can have a better workday and have our patients have a better quality of life.